anyone on a GLP-1, if you're being prescribed it responsibly, it's like you have to know you've got to eat enough dietary protein. It's like protein in vegetables and fiber. Like that's your major dietary concentration while you're on it, staying well hydrated, right? Because we don't want muscle mass loss. There's some people that, I say this all the time to my patients. It's like, you don't want to go from eating a bowl of macaroni and cheese to eating a bowl of macaroni and cheese because the GLP-1 has decreased your appetite. Yeah, you'll lose weight, but you're probably going to lose muscle mass with it. And you're not going to be a healthier person.
No.
Like some things will change. Some biomarkers will change for the positive, but we want to use it as an opportunity to create the healthy habit so that the food noise goes away. So you're able to make decisions like, hey, instead of going to get, takeout for pizza, I'm going to go home and eat the broccoli and salmon that's in my fridge because it's the right thing to do. It takes away, it helps. So the GLP-1 family, I find to be really helpful. Obviously it's FDA approved for obesity and type 2 diabetes and sleep apnea, but we're using it for, all kinds of other, you do like the micro dosing essentially, right? So like doing a dose that's not, one of the like traditional pharmaceutical, dosages.
What's the other, like tirzepatide is like the other?
Yeah, so there's semaglutide and tirzepatide are the two that are out. And then there's a third one called retatrutide I think it's scheduled to be out maybe in 2027. I think it's in phase 3 trials right now, if I remember correctly. But that works on 3 receptors versus 2, like tirzepatide, and semaglutide is just a straight GLP-1.
It just makes you less hungry.
Or
like that's the big.
Yes, but like I know it's not as easy as that, right? It slows, gastric emptying, so you're fuller faster, and it really does. It's the GLP-1s are also being studied for addiction. Like it changes your brain chemistry. Like food is an addiction, just like your drugs and alcohol, and so it's also being studied in those in those realms as well.
And so they'd have to do it forever.
So that's a great question. There are some people that that are able to get it together, let's say, while they're on the GLP-1. They use it as a great opportunity to
change habits,
get their food dialed in, their exercise, their sleep, get all their stuff dialed in. And then once they're got their goal weight, the name of the game is like, what's the lowest dose that keeps you there? Or can we, get you completely off? Because truthfully, when someone comes off a GLP-1, the appetite does come back. So if you're food cravings, if you give into the food cravings of like, I'm going to get pizza on the way home instead of eating my broccoli and salmon, like what do you think will happen?